I think root canal treatment is a common procedure, especially if the tooth is already compromised and need a crown. So yeah, I think it's a common procedure here. I think this is a very good question. So when the patient have extreme pain to hot and cold, if there is pain to sweet, if that pain lasts for more than a few seconds, it's actually a sign that his tooth might need a root canal treatment. Another sign is that when the patient bite or try to have some function on that tooth, if he feels pain, so this indicates that his tooth, it might need a root canal treatment. Worst case scenario, that if you have such kind of a swelling associated with that tooth, it's also an indication for root canal treatment. If unfortunately a decay is actually reaching the root canal space, so in this case we need a root canal treatment. But at the same time, if the tooth is restaurable, and I mean with that it can actually take a crown or a filling, in this case it is a good candidate to go for a root canal treatment. Again, a very good question. So we have certain tools and equipment in our clinic to allow us to diagnose a case, including the cold test and a machine which is called electric bulb testing, in which it can also add another value. And a very unique thing in Vilafortuny that we have a CBCT machine, so in case if we cannot see what's happening in a 2D radiograph, we can take 3D scans with the CBCT, in which it will allow us to see the structure in 3D.
And that's a 360?
Exactly, yeah.
Okay.
So the first step is that we need to numb the patient and make sure that he won't feel the procedure and he will be comfortable during the whole procedure. Then we will just try to gain access to the root canal space. Then we simply take the infected nerve out, then we clean with mechanical and chemical instruments and techniques, and then we just fill it back. More than 90% of the time, they will feel just comfortable. In some rare cases, the patient might feel some pain after the procedure, and in these cases, we call it flare-up, but it is easily manageable if the patient will follow the post-operative instructions.
What about the day after that?
The day after that, I think the patient can function as normal as it can be. The tooth is alive and dead at the same time.
Okay.
I mean, it is, if you think about the tissue inside the tooth, it is gone. It's not there anymore. But the tooth is alive at the same time because actually it is in the bone and it is attached to some soft and hard tissue in the bone. So it is actually considered still alive, functional on it within the bone. And that is the advantage of having a root canal over an implant, because when you chew on a natural tooth, it looks like a normal tooth. So. Most failure that happen with root canal treatment, it is just because the patient, he just ignore having a final filling or a crown after the procedure. And that's why we really advise our patient to have either a final filling or a crown as soon as possible just after the root canal treatment. Yeah, of course.
Totally normal?
Yeah.
Okay.
So again, when we talked about what is a good candidate for a root canal treatment, is that when the decay is reaching the nerve and then it's need a root canal. But we say that it should be restaurable. And what we mean with that is that we can put a crown on the tooth. So the dental implant, it will become a very good alternative if the tooth is not restaurable anymore. I mean, if the decay or if the fracture really destructed the tooth in certain level that we cannot place a crown. So in this case, yes, it is a good candidate
the
for
last
implant.
alternative.
Exactly. Okay, so first we have, I will speak step by step. So we have the diagnostic instruments that we already spoke about. Then we have the microscope, in which it's really made a huge change in our work and in our endodontic procedure. Then we have the rotary instruments. It is that instruments in which it will allow us to clean a root canal space. And we will be able to attach a very flexible titanium files into those instruments, and it can allow us to really appreciate the root canal anatomy. The second thing, we have something which is called the apex locator. It is like an electronic device in which it can allow us to measure the length of the tooth and avoiding taking tons of x-rays as in the old time. Talking about X-ray, we are fortunate in Vilafortuny of having a digital radiograph in which it can really reduce the dose that the patient is getting during the procedure. I think the best thing to reduce the post-operative pain is the proper diagnosis and treatment planning.
Right.
So if we really would diagnose the case, if we really understand the pain that the patient is having, and this can guide us actually to do a certain treatment plan that will really reduce the pain after the procedure.
Right.
Talking about the procedure itself, when we talk about numbing, although it's like a single word, but we have different techniques that we can use to do the numbing procedure. We have also a very slow machine that it can numb the tooth in a certain direction, but it's more of a science, so I don't think that we have time to speak about that. There is a very large study done in the States which indicate that when the root canal treatment is done in the proper way, it has actually a success rate of more than 90%. Most of the failures happen again because the patient just ignore having a final crown or a final restoration. So yes, it has a very high success rate, and it is comparable to dental implants. Most people think it's a painful procedure, but it is not. If you really are able to diagnose the case, and if you really do the numbing procedure really well, it's a very comfortable procedure. We have many patients that actually fall asleep during the procedure. The second misconception is something called the focal infection theory, that people really think that having a tooth or having a tooth which has a root canal treatment done, it's like a source of infection to the other part of the body. But this has been proven wrong by the American Association of Endodontics and the European Association of Endodontics as well. Prevention, which is trying to clean 3 times a day, try to brush, and the 6-month checkup. This is one of the most important tools, because many people, although they brush, but they don't use the floss, and they just develop decay without their knowledge. So the 6 months of follow-up with the hygienist, having x-rays or eye twins is really important. Okay, so a root canal treatment can be done by any dentist, but why we have specialists? Because specialists are equipped with extra years of training to really not only do the procedure itself, but to diagnose the issue, to know what is the biological background of the root canal treatment, and then to perform the root canal treatment to the highest level. And using our latest equipments, including the microscopes, the rotary, the filling materials, and so on. So to really deliver the root canal to the highest level, we need to have an appointment with a specialist who have really extra years of training. The procedure is painful? No. Will I feel pain after the procedure? No. Will my tooth crack after a root canal treatment? Yes, if you don't put a crown or a very good filling. And that's it, I think.